Good afternoon, everyone, and welcome to the O'Brien Institute in Community Health Sciences seminar series. I'm Diane Mosier, and I am the Associate Dean for the Indigenous Local Global Health Office. And today's presentation is Pathways to Healing, an Indigenous Local and Global Health Office initiative to catalyze development in critical Indigenous health education. Next slide, please. So the land acknowledgement is really a traditional way of greeting for our Indigenous people, and it is a sign of respect and acknowledgement of the people who came before us on this land. I'd like to acknowledge the traditional territories of the people of Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda Nation, including Chiniki, Bearspaw, and Wellesley Nations. The city of Calgary is home to the Métis Nation of Alberta Region 3. The Indigenous Local Global Health Office has our strategy, which is from 2021 to 2024, which is really creating the future of health and social equity, with really a mission to champion health and social equity-oriented medical school, nurturing those respectful relationships with diverse communities, promoting collaborative and innovative models of engagement, informing our curriculum and research, and co-designing initiatives for impact. Our goal really is to grow that culture that values and dignifies human difference. We want to institutionalize community and partner-driven equity priorities through meaningful and reciprocal engagement, of which which we are going to discuss as well today, and expand our institutional capacity to innovate and learn together with partners and community. Next slide, please. So this is our structure. So we support all areas of the Cummings School of Medicine. That I'm the Associate Dean, and Lindsay, who was speaking, Dr. Lindsay Croson, who was speaking in a minute, is the Assistant Dean in the Indigenous Health Program. Dr. Pam Roach is our Director of Education. Holliston Logan is the ILGH and Indigenous Health Program Coordinator. And Kate Dunn is a Research Associate also within the Indigenous Health Program. So I'll turn this over to the next slide.
Hi there. So it's my turn, is it?
Yes, you're up.
I'm Lindsay Croson, and I'm Assistant Dean in the ILGH office, Associate Professor in Family Medicine, a family doctor, and I'm from the Piikani Nation, one of the Blackfoot tribes, and zooming to you from my basement. Part of this conversation today is to share where this concept comes from, and direct links to the Truth and Reconciliation Commission of Canada calls to action. The Health Legacy calls to action were those that we focused on, and the notions of teaching and learning, you can see in calls 23 to 24 that speak to skills and approaches that we have to facilitate through teaching and learning. The concepts and constructs of health systems transformation is connected to how education is fundamental to that. To be honest, we look more broadly at the calls to action when we as a Cummings School of Medicine engaged in looking closely at the calls to action, and we called that initiative the Indigenous Health Dialogue. Can I have the next slide, please? So what we did was to take each of those calls to action and contextualize the concept that the call was speaking to our institution from an educational point of view, from a research point of view, from a community service, healthcare service point of view, from a learner point of view, from a faculty and leadership point of view, from an Indigenous and non-Indigenous point of view. So we engaged in deep dialogue as to what these might mean, and developed a framework for our school to engage in, to self-activate. And we identify two upper themes to work towards, the distinctness of the context and knowledges that Indigenous health provides within our school, and our actions towards making a difference, and the support, the promotion and supporting of inclusion within the academy of not just people but knowledge. Today we focus on education as a clear concept to move forward. Here on the slide you can see how we frame a reconciliatory theme around education and some truths that we saw and that we hope to shift and change and help us to move forward into some potential actions, such as addressing institutional barriers, investing in high level, excellent, innovative health education regarding Indigenous peoples within our school. So anyway, next slide, please. Within that process called the Indigenous Health Dialogue, where we took that framework and then worked across our medical school to discuss and engage and explore and to build upon the ideas, we located 5 directions for us within our school to move forward in the spirit of truth and reconciliation as a critical directive, in line with the United Nations Declaration for the Rights of Indigenous Peoples. So we see that these directives are important moments in time for us to take stock and then be inspired and move forward. And so from the Indigenous Health Dialogue, we have these 5 directions, and I'll highlight the educational one. So as a statement of aspiration to build Indigenous health education content and facilitation excellence across all units, with an aim to ensure graduates, faculty are equipped with critical knowledge of Indigenous health, critical knowledge and skills of Indigenous health. We position ourselves in the Indigenous Local Global Health Office as facilitators. It is very clear that we can be stretched super thin as Indigenous educators, so it's been our mission to develop capacity for co-learning, co-teaching, so that there are structures and knowledge frameworks and capacities across our institution, because it's quite not feasible for just a few Indigenous peoples to do all of the required teaching. So next slide, please. And I pass this over to Dr. Roach.
Thank you. So thanks, everybody. I'm Pam Roach, as many of you know, I think, and you've already heard. And I think, as we started thinking about the Indigenous Health Dialogue and our response to the TRC, we were also keeping in mind some other directives that have come out. So in 2019, AFMC released the Joint Commitment to Action on Indigenous Health, which provided a series of action points for schools, and every medical school across the country had signed on to these actions. And then at the end of 2020, I'm sure many of you have heard, if not all of you, about the death of Joyce Echaquan in a Quebec emergency room. And that really spurred on some federal conversations and led to some federal funding being provided to actually support something called the National Consortium on Indigenous Medical Education, which has just completed its first year of activities, which is really a development year. There's a few of us here at the Cummings School of Medicine who are involved in some of the different working groups there. But then now we have sort of a national direction in a lot of different capacities when we're thinking about Indigenous health education within medical education. So I can share that there's 6 working groups. There's curriculum. There's a group that works specifically on curriculum across UME, PGME, continuing medical education and faculty development. There's anti-racism. There's admissions and transitions, faculty recruitment, anti-racism, as well as wellness in the workplace for faculty. So we are sort of thinking about connecting and how do we build our own capacity. We'll have some national linkages and ways to share best practice and innovation, but there's still a lot of work here at the school to do, and how do we do that, and how do we do that in a great way that facilitates all of the people who want to get involved. And so maybe if we move on to the next slide, I'll speak a little bit to the conversations and how the Pathways to Healing initiative was envisioned. And we know that about close to a year ago, the first announcement came out in May 2021 around some of the children that were recovered at a residential school, and there's been continuing investigations at many schools since, and I think the current number is over 10,000 potential children. So the school wanted to release a statement. When we think about the fact that we have a responsibility and an obligation in responding to the TRC, to other federal, medical education focused guidelines, we have clear directions. We have all of the work that Lindsay and Cheryl and Rita put in to develop the Indigenous Health Dialogue and that huge process. What did this mean for the school? And so the school released a statement. When we think about the way we educate physicians, there's really a direct role to play there in the response to the TRC. And our conversations really focused around wanting to do something. So it's important to release a statement, but we have to move beyond just having a statement and expressing our condolences. I just got off a call with Indigenous students, and I think a lot about this. I think a lot about the need for more students. I think a lot about the struggles that students face and that patients face, and how different that would be if, all of these children that we're recovering now were here, and their children who are here and their grandchildren were here, and how different this place may be, meaning all of society, right? And so without getting too in depth there, I spent a lot of time reflecting on that. And so I think it was important for us to think about what action can we do? How can we mobilize people's interest and people's understanding? And we do a lot of teaching, we do a lot of education, and there's people who want to get involved and weren't sure how. So we know that we have excellent researchers and educators and scholars and people with community relationships. So we needed a way to catalyze that, and we needed a way to bring people together and to kind of share this knowledge and build capacity. So with the release of this statement was also a commitment from a number of different offices, a number of different institutions and research institutes across the University of Calgary to fund Indigenous health education work in a way where we could provide a supportive environment for people to develop this work and these projects and these directions in a way that we can, link people to the educational resources for their own learning that they may need, and build relationships and continue to build our relationships and capacity across the school. So with the contribution of funds, we were able to set up this initiative where we can provide funds and projects to other people and teams. So maybe on that note, I've left the statement up there for everyone to read. And just wanted to give you some background to that. And I'll pass it over to Kate, who's our research associate for the Pathways to Healing initiative, who will explain a little bit more about the structure of that.
Great. Good afternoon, everybody. So the Pathways to Healing was inspired by this commitment to create change amidst the continued impacts of the residential schools across Canada, and how can we actively be involved in a process to make an impact for change. So by supporting community partnerships and projects for Indigenous education to improve Indigenous health outcomes and advance reconciliation in medical education and community, while engaging with community of practice to generate knowledge and support and to celebrate and to share. And we put all of those in together, I think, as well as reflecting also it's important to celebrate and share where we are and the opportunities we do have and the opportunities to collaborate. And that was how this community of practice began to take shape as well, to be a part of this process, which is turned into we call it Pathways to Healing circles. And it has become a community of practice where it's a safe space for discussion of ideas, for building relationships, engaging in peer-based learning, Sometimes we have some speakers come in and share about their experiences within Indigenous health research or medical education opportunities, their experience, different aspects that we can incorporate in our work and our different aspects of our professional lives, as well as any project ideas, and seeking guidance from each other in this safe space, as well as this space has also been in lieu of a letter of intent. So people share their ideas for a project. We kind of discuss, network, collaborate, build upon the ideas, help support that process. So the space has become a community of practice, as well as kind of like a sharing and learning circle in a unique way that has provided a great opportunity to get together. I know I look forward to the circles, and I've heard a lot of positive feedback from attendees who really enjoy the space, and every time are challenged in a different way to think about something from a different perspective they may not have thought about it before, based on our really honest and open discussions and conversations and the speakers that we have join us. So also then taking this kind of a different approach and approaching the funding application process also with an open mind, and trying to incorporate Indigenous ways of doing and sharing knowledge. So we're taking the process of the sharing circles as part of this oral tradition of sharing ideas and building each other up, and take that into the application process. And we've had quite a few applications in the first call for this. And with some of them, we were able to provide an opportunity, instead of here's the winners and here's the losers, but an opportunity of, we really like this idea that you're sharing with us. Let's build on it. Let's add in some of these. Let's talk about it. Here's some other resources for funding, but let's keep the conversation going so that everyone is a winner in some way, shape, or form, and we're all continuing this process of making change moving forward together. So it's been an iterative process as we work through this, but I think that we're going to hear from some of the people who have been joining us in these circles in a few minutes, and Pam's going to share about the options for the funding call.
Thanks, Kate. Yeah, and I think I'll just share too with the circles. I think what's been really, really wonderful is hearing that people enjoy the supportive nature of it. So really, when we think about, if our intent is to build capacity within our school, the funding opportunity will look a bit different. So it's not a case of we want everyone to be really competitive, but how do we support each other to do this, and what do people need to do and collaborate, and what do they need to know to be able to do that? So the idea that you embed an oral tradition into what's typically a letter of intent actually is very supportive, and it allows people to explore and come back and ask questions, and ask questions about the funding opportunity. And in that way, people have expressed that it's been very different, and they've been appreciative of that nature. So we do have 3 different types of grants, of funding opportunities to apply for. And we wanted to make them in such a way so that we know that not everybody may need every type of support, but that also, as things develop, you may decide that you do need that kind of support. And so being able to be flexible in that way. So we came up with 3 sort of stackable funding options. The first one is a development grant of up to $5,000. So you have an idea, you need some time to explore it. You might need some funding for community engagement, to fund perhaps a research assistant salary part-time, or exploring community partners and what their needs are. And so we wanted to provide that option for people who were sort of more at the beginning stages and maybe were building relationships. Then we have that implementation evaluation style grant, where you have that development piece done and you need some funding to be able to support the completion of a research project and the development of educational materials or whatever it may be. So up to 10,000, recognizing that there's usually some extra costs there. And then a knowledge sharing grant of up to 2,500 that could support community engagement, knowledge translation, events, those kinds of things, to help disseminate the information and communication of what you do. And so we thought that some people, they might want to stack the development and implementation grant together, or an implementation and knowledge sharing grant together, to have a little bit of longitudinal work there. And also recognizing that people may apply for 1 or 2 options, but then come back and maybe actually think for the next round, I do actually want to apply for some knowledge sharing money as well. So we kind of, I've, jokingly refer to this as like our Lego grant scheme, that you can stack them on top of each other, but really wanted to provide a flexible way for people to engage where they are, knowing that not everybody is sort of at the same stage. So being able to support people and sort of envision where the work could go. And then I think on the next slide, I'll give you a very brief bit of information about one project that I'm actually involved in, and supported some colleagues to conceptualize and lead. Before I hand it over to one of our applicants, we have implemented a new longitudinal Indigenous health elective in the Department of Family Medicine for our family medicine residents. And so this is for residents who are interested in Indigenous health and practicing in Indigenous communities, and perhaps wanted to gain more exposure and continuity in working in the same clinic. So that was implemented over the past year with our family medicine Indigenous health working group. And we actually had more interest in it than we had spots. And so there's a clear need for it and a clear need to continue it. And so Doctors Amy Goswick and Molly Whalen Brown wanted to evaluate the process. So this new sort of elective in PGME, and with the goal of hopefully understanding what are the key factors that make it work. What are the key factors that make it helpful for the clinical setting, so the staff and the clinicians and the preceptors there and the patients, but then also for the learners, and hopefully with the goal of understanding that so that we can inform other PGME programs who may also want to develop similar sort of longitudinal electives. And that speaks to those, not only the calls to action from the TRC around longitudinal Indigenous health education, but then also those action points from the AFMC Indigenous Health Joint Commitment to Action around embedding longitudinal Indigenous health education across all of our education streams. And so in that way, we are going beyond just thinking of, okay, well, we have this many spaces in pre-clerkship, or we have this many spaces in the Bachelor's of Health Sciences, and how do we connect things? But actually, even after people transition into different programs, how do we continue to support our learners to hopefully move towards better outcomes for Indigenous patients? So that is a piece of work that's hopefully going to be getting started over the summer. And I just met with Dr. Goswick this morning, and she's very excited to get going. And we're hopeful that it'll give some insight to people, continue and perhaps expand the program and understand what are the supports out there that the preceptors need as well, so that we can work towards that as a school. So on that note, maybe at this point, I'll hand over to some of our guests here that we also have on to speak about another project that was funded in our first call.
Yeah, hi everyone. My name is Whitney Hindmarch, and I'm a project manager for a youth mental health research program called Mental Health Research for Kids. And Jen, I'll let you introduce yourself.
Sure. Hi, I'm Jennifer Markides. I'm an assistant professor in the Workland School of Education, as well as in the Faculty of Social Work. I'm a member of the Métis Nation of Alberta, and my work centers around the well-being of Indigenous youth, and particular in education. And so I joined the Pathways to Healing group to really just to learn about it and to find out what sort of funding opportunities were available that would support well-being of Indigenous youth, and ways that that might fit with my research program. And through that group, I met Whitney. So it was really serendipitous that we were brought together through this opportunity. And Whitney will speak a little bit more to the project that we proposed.
Yeah, so I'll maybe give a little bit of context for where our project came from and what we're really hoping to achieve, and how the engaging with the Pathways to Healing circles have really helped us with developing this project. So Calgary is going to be getting some new child and adolescent, as well as some emerging adult mental health services. And there's a couple teams at the University of Calgary that have come together just to develop some research programs that will be associated with these new services. So this project that we're talking about here today is really to develop some youth advisory councils to help us co-design these research programs. And we're developing these advisory councils with some Indigenous youth leadership. So really the goal is to, help us determine to help us build some research programs that have sorry, my dog's barking in the background. I'm a bit distracted. Sorry about that. So we really think it's important as we're developing these research programs to get youth perspectives, so that the research questions that we're asking and the programs that we're developing and the way that we're asking these questions really reflects the voices of those with lived and living experiences. And with the Indigenous leadership component, we're really wanting them to help us determine, how we're working together and how we can capture the perspectives of many diverse youth to help us really develop some impactful research programs and projects that are inclusive. So we wanted to create this intentional space of partnership with Indigenous youth, because we recognize that this population really does face some health inequities and is often underrepresented in child and adolescent mental health research. And that really only furthers health inequities by reducing the generalizability of research findings to these underrepresented populations. So we're hoping that with co-designing and partnering with Indigenous youth, it will help us kind of reduce some of those barriers to these populations engaging with research. And in order to kind of have to kind of share our learnings, we're planning on developing some educational outputs that will involve digital storytelling components that will really be led by this Indigenous youth population. That will help capture, the process of bringing this group of young people together and how they've influenced research from their perspective and how this has really impacted them and maybe their families and communities. And the Pathway to Healing circles have really helped us develop this project by highlighting some key considerations for working with Indigenous youth, as well as really providing some thoughtful feedback on ways to approach the project as well as engagement. And it's been really, really helpful to be part of the circles and hear from others doing similar or different work, and kind of what challenges and successes they have faced, and how they've adapted. And it's really been a great process to be involved in. So I'll maybe, I'm not sure, Jen, if there's anything else you wanted to add.
No, you've spoken beautifully to the project. Thank you, Whitney.
Thank you so much, Whitney and Jennifer. So we're just going to put a few resources up on the screen for everyone to feel free to engage with while we wait for a few questions to come in, and I'll help to moderate those questions. I'm Holliston Logan. I'm the Indigenous Health Program Coordinator. And on the screen, I've included some links to the Indigenous Local and Global Health Office. And through that site, you can also find the Indigenous Health Dialogue, which Dr. Croce was talking about, if you want to read through that in more depth and read through the different themes that were presented. As well, we do have the Indigenous Health Education Pathways to Healing site, where you can sign up to join those teaching and learning sharing circles. And we also have our mailing list. So we have an Indigenous Local and Global Health Office newsletter, as well as an Indigenous Health Program specific newsletter. And you can also feel free to connect with either Kate or myself to engage with our office and the work we do, or specifically with the Pathways to Healing project. So if you do have some questions, I do encourage you to put them in the Q&A functionality. And I'll put up one question here first that I think, Pam, would be appropriate for you to answer. So we have a question that says, it's wonderful to hear about the longitudinal elective in family medicine, and was wondering if there was any thought to opening this or similar type programs to residents in other areas where Indigenous health and wellness is disproportionately impacted.
Thanks, Holly. So that's a great question. I can see that thinking kidney disease specifically. Yeah, so the work to develop the longitudinal elective, like I can't and wouldn't dream of taking credit for that. We in family medicine have an Indigenous health working group. So the idea has sort of emerged there. And then all of the amazing people who work in PGME worked really hard to figure out the logistics for that and the placements for that. What I would say, so that's sort of like my family medicine hat. But from an ILGH educational hat, I would be, more than happy. I would really welcome conversations with any program who I think, if you're interested in learning from what we did in family medicine, to understand how that might apply in your own program. I think I would absolutely welcome any conversations around that, because there's lots of different, I think, the educational streams and different programs where it could be really great. And I think that idea of embedding a longitudinal experience in a setting where we can support people to get that experience and to really engage in improving Indigenous patients' lives would be wonderful. So always open to those conversations. And if I can help facilitate connections and understandings through what we did and share that, definitely open to that, and feel free to reach out. And I will be sharing, as we kind of figure out what were the things that are making this a successful program, be sharing those out with everybody as well. And then part of my work, right, is to kind of help different programs figure that out for what they want to do as well. So definitely. And I would say, I don't think we had a link up there to where the circles, there's a link to the ILGH website and the pathways, but they're every 2 weeks on a Thursday at lunch over Zoom. So we know that that's a way that a lot of you very busy people can link into them and join from wherever you might be. But the last one was last week on Thursday. So the next one will be next Thursday at lunchtime. So you can register for that and sign up and join us for a conversation. And I think having Jennifer and Whitney here is a beautiful example of what we're hoping to do through that mechanism, right? Is that connection, and that actually we've had a number of people who have met other collaborators in those circles who work in their area and can contribute things and been able to envision projects that they can do together. And we have people from all across the university join. So kinesiology, social work, education, nursing, medicine. So just a really, really interesting and multidisciplinary group of folks to really give some great insights.
Thank you so much, Pam. Those are some great reflections on the learning circles and the community of practice that's been developing. And just building on that, I wanted to ask Lindsay, what are some of your reflections on how that community of practice has been developing and what you hope to see for it in future months, years to come?
Thanks, Holly. I think I'll answer the last question as well, if that's okay. Just to add to what Pam shared, this is something that I would see as a model, right, for other people to choose to do. It would take those people in a department area to plan it and organize it, look at the model and say, how does it fit for them? Because there are some essential principles that there's there's a need for a longitudinal experience so that one gains a deeper understanding of the issues and moves beyond the usual learner objective of I want to know what the clinical resources and outside clinical resources, I want to know what those resources are for working with Indigenous peoples, which I find is an important objective that residents all have, but it's more than that. It's not just a structural understanding of the system. It's like deep exploration of racism. It's deep exploration of what this means of social support, of structural violence, of how culture plays a role. And these are sort of intentional, reflective questions that we're building that would lay a foundation of when residents would come, that they would be asked to think about these questions and think about this specific question on this day, and then engage with their preceptor and their patients through it, reflect on it, talk to their home preceptor, their own supervising preceptor that they go back to in family medicine, to engage them, so that we build an interconnection of knowledge between that resident and those preceptors they come from. Because we want to have, or we're hoping that there's a cascading of conversations and knowledge and capacity through this longitudinal experience. So I would say that any other department, PGME department that wants to do it, could take a look at the model, take a look at the principles, take a look at the concepts, see the emerging reflective lenses and questions. We had intentions to develop some brief videos to help a resident to make sense of, with a little brief package that then they would then ask some reflective questions of themselves, as well as their local location Indigenous Health Service preceptor, as well as their home preceptor, and maybe with their other residents over time. So anyway, so that was the nature of that. So if one is interested, probably just connect with us in Family Med, and can get an overview of the idea. Happy to chat. I think, and many people see different innovations or different approaches or different contexts that would enhance all of us. So anyway, so that's the scoop with that. And your question was about the community of practice. I think the nature of the community of practice is a space for people to feel welcomed within, right? Because the facilitation is relatively simple. I'm really interested in hearing what you bring to the table today, right? And maybe it's very formative. Maybe it's something you've done and that you have lessons learned. Maybe it's something you'd like to do, right? Maybe it's something in progress, right? Maybe it's something you need some feedback on. The conversations have been varied, and giving space, it means that we follow a very narrative mode. It's an oral tradition approach where we listen, and then we engage, right? And it seems like there's moments where a sharer is asking questions, and then a group of people that are not just me and Pam and people that have experience in Indigenous health, but those who are at the table, who are building experience, say, oh yeah, this is what I saw, and this is how it worked. And so there's like this very much interactive sort of engagement that built knowledge and built sort of a communal approach to making sense of it and building each other up. So that's what I saw, and that's what I see. I see there's need to have simplicity of it, that there's a reason for people to come together because they feel like they get something out of it, and they might have a chance, or they might be willing to share. It seems in the times that I've come, I would hear people say, oh, I've been listening for a while, and I'd like to share today. I think I'm ready to share. I'm really happy to share now. I've been brewing this idea up for a while, right? And so there's a really interesting cross integration of ideas that are brought to the table in that conversation. There's like I say, lots of support of an idea, a lot of input into some possibilities, right? So I think that's what I see. There's always the need to ask, how does this fit in the nature of why we come together, right? Why does this fit, and how does this fit? How can we facilitate that fit to ensure that we are living up to this call of an educational focus of this community of practice, and to ensure that we have the educational aspects and the approaches to teach in our school around adversity, around historical trauma, around those outcomes of the impacts of residential school, so that we can walk beside our patients and communities in the healing process rather than us, making it worse, right? Us ignoring it, us not comprehending it, and us not doing anything in with that person or with that community. So how can we as a school be better? How can we as individuals who engage with Indigenous peoples do a much better job to help that healing journey? Because we were all, in our conversations when we heard the Kamloops story, we're so devastated, and the loss and the ongoing trauma and the ongoing suffering and all that stuff reawakened, and it just was clear to us, how do we help? I know that the answer was, well, do more teaching, but we can't just do more teaching if there's only a couple of us, right? I need to have you all do the teaching, and that I'm happy to be a helper, so that you gain knowledge and skills around that, and that you connect with people that are building their knowledge and skills. So maybe there's a co-learning, a co-teaching with other Indigenous peoples, or maybe there's other innovations, right? But nonetheless, there's a group check-in, a group process. So the community of practice is meant for all of that. Is to say, hey, I'm building this thing and I'm still struggling, and when I did it, I was like, the residents really shot it down and pushed against the idea of racism. What do we do, right? And maybe the group can help. Maybe Pam has great insight, which she does, around those issues, right? And maybe we need to look far and abroad, right? I know that New Zealand and Australia, with their leaders in Indigenous medical education, this is a big topic, learner resistance to these concepts, right? Ongoing resistance to within our teaching and learning, knowing that Indigenous health has always been sidelined in our biomedicine sort of learning sort of focus, and that the nature of the knowledge that we bring is very distinct and broad, and it's always resisted, right? And how do we develop those strategies? But I think mostly, how do we develop those capacities amongst many people in our school to engage in those complex teaching times, and then help each other to be the best we can, right? That's what this is all about, and I think that's the potential for a community of practice is to learn and share, commiserate, prop each other up, and say, hey, have you thought of this? Let's give that a go, or here's my teaching session. I would love to run it by you. Let's go and I'll share it now. What do you think? Let's have a conversation. These are my thoughts at facilitation. Let's engage in that. So it's a space to build and develop, co-learn, co-share, and spread the possibility of doing a great job amongst many people, amongst all of the units in our institution. There's my ramble. I'll stop there.
Thank you, Lindsay. And my next question is for Kate. So as someone who's hosting these circles every other week and then continuing that engagement with the attendees through email and conversations outside of those circles, I was wondering if you could share a little bit about the impact you see these circles having on those who are engaging with them, and any words of encouragement or advice for others who haven't yet engaged and maybe want to going forward.
Well, a lot of times at the end of the circle, you know how you put comments in the chat box? Almost every single time there are really deeply appreciative comments for the space that this has created for people to think outside of their normal operating work expectations. We've had quite a variety of guest speakers, some sharing on cultural relevance, some like the one coming up next week. She's going to share about why we all need to care about Indigenous data and data governance, and why all of us should be thinking about that. And so it's just little things. They're not a big formal presentation. It's a conversation to make you think, to then internalize that and take it with you in your professional engagement, in your personal engagements, in the projects that you're thinking about. And I appreciate the sessions. And I've gotten tons of feedback of people who just go, wow, I never thought about that before, or this was such a great way for me to shift my glasses, look through a different lens. I really appreciate this space. So a lot of people have appreciated that. Also, in the process of the applications for funding, as we hit on a little earlier, how normally you turn in an application and you wait for that letter. Okay, did I get it or did I not? And it's always, we're so sorry. But even the applications who we were very sorry, we still worked with them. Have you thought about this? What about this? Or here's some of the feedback from reviewing the application. And this was really phenomenal, but what about shifting it like this? And then working through how to shift to make it more practical, useful. Maybe even it's just a shifting into a different lens or incorporating personal experience into what we normally would just see as oh, this is just a research project. Well, it could be, or you can really go about it in a reflective way, in a different way. And I think that's what we're trying to do here through each phase of this. And the feedback we've gotten is that, yes, you're really making me think in a different way, which is a good thing.
Thank you, Kate. And I think my final question, oh, hang on. We have one that popped into the Q&A. I'll do that one first before I go back to my question is, can you please add to the chat or tell us again how, when, and where we can ask to or come to the sharing circles? So Pam, do you want to just give us a quick refresher of how folks can engage with that? And perhaps we can get that link popped into the chat for the circles as well.
Yeah, definitely. So thanks for the question. And I think if we can get the link popped into the chat box for everybody, that would be wonderful. So they're every 2 weeks at lunchtime, so noon till 1. And if you go to the ILGH website, so the Indigenous Local and Global Health Office website, and go to the Pathways to Healing, and then there's a little link to register to sign up, so you can get the link to join. And it's really great. So the next one is next Thursday, which is, because I'm looking at dates, the 5th of May at noon. And then they're every 2 weeks after that at noon until the summer. And we suspect we may be taking a little bit of an extended break, or just having them maybe once a month in the summer, just recognizing that it's harder for people to be around. But you're welcome to come, and you're welcome to come to many of the circles. Like Lindsay was saying, that a lot of people will come and listen, and then they'll join in later, or people will come and sometimes ask, like, hey, I have something I want to talk about. I just need to bounce some ideas off and see what people think. And it's a really lovely way to get feedback on your thoughts, and to, have people contribute and give you some ideas of either like literature or connections, or just some things to think about that maybe hadn't occurred to you. And it's a really facilitative way of thinking about the work and the ways in which we do it. And I think for me, it's not only sort of doing that regular academic stuff that we all do, and doing research and writing up papers and doing all those kind of applying for grants, but it's also just embedding that different way of working. How do we work in a more collaborative, relational way with each other, where we know that the goal isn't about us, the goal is about doing the work that impacts people out in the community and in the clinics and in the health system. So I hope you join. I hope you all feel welcome to join and have these conversations with us.
Thank you so much, Pam. And I just popped the link to the Pathways to Healing webpage in the chat. And if you scroll down on that page, that's where you'll find the links to the circles where you're able to register for them. And so my last question is for Dr. Mosier. And I was just wondering if you had any other comments for how different units and groups and departments across the Cummings School of Medicine can engage with either the Pathways to Healing initiative or with the Indigenous Local and Global Health Office as a whole.
Okay, I was actually the first question to address that
Yeah,
I do, in terms of the longitudinal learning, I do a clinic in Stony Health Clinic as well, and with medicine, and thanks, Sophia, that maybe we can talk about Department of Medicine and how they can do something similar to family practice, because it's diabetes, it's renal disease, it's rheumatology. There's certainly a number of areas and that the Department of Medicine could be able to take a leadership with this. I think that in terms of the office, we're right across from Feasby Lounge. Everyone is welcome. Holly, as you can see in the background, Holly's in the Indigenous Hub, which we just had blessed last week. And so everyone, there's open houses and everyone's welcome to come and visit us on the first floor across from Feasby Lounge when you go to get your lunch or coffee at On the Go. And I think that happy to have you come and engage in conversations, and any ideas are welcome. So thank you.